Who is more at risk of falling into or living in poverty? Firstly, people with special needs, including physical or mental difficulties, long-term illness. They are vulnerable and unlikely to be able to find a stable and well-paying job, end up living with low income or no income at all. Secondly, lone parents, especially a single mother with young children. This group of people usually have limited choices when looking for jobs because they often struggle to meet their work schedule while being the only person to take care of their children. Thirdly, indigenous peoples, visible minority, and new immigrants. They are at risk because they often face systemic discrimination when it comes to job hunting or even in their career. For example, a girl with Bangladesh name on her resume doesn't even have a chance for interview, but after she changed her name into a typical Caucasian name, everything becomes different. Lastly, new graduates or people with less than high school education are at risk of falling into poverty. This is due to their limited working experiences or undeveloped skills, etc. If I was given the power to make change to social policy, I would work on making Ontario's Medicare system more efficient, to reduce the waiting time and make wider coverage accessible for Ontario residents, such as basic dental care and prescription drugs. I'll make certain that Indigenous community and the visible minority community are fully covered by our healthcare system to eliminate healthcare inequity in Ontario. These tasks are easier said than done. It takes time and is not possible without the support of the federal government. The shortage of medical personnel is a long-term and a nationwide issue. If I were the premier, I will advise the provincial government to increase or set a special funding to support medical students who are committed to working in Ontario after graduation. Make doctor a most desired occupation that's worth pursuing for young generations. I will urge federal government to prioritize immigration policy for applicants with international certificate and a certain medical background. This will greatly reduce the time of educating and training a doctor